Hey, my name is Brian Christensen. I did my evidence-based practice on whole body cryotherapy. The purpose of this study was to determine the physiological and subjective responses in athletes using whole body cryotherapy. The subjects, it was pretty broad, or not broad, but there was a lot of different athletes that were tested in this article or this research. But specifically for one of them, there was 27 rugby players. It was during a summer training session. They were limited on their diets to keep their blood levels a little more even. Their cryotherapy sessions, they did 2 sessions, a morning and an afternoon, for 7 straight days. They had their blood levels monitored. And some of the other test subjects were the Polish military. There were also tennis players, kayakers, and some track athletes among some of the test pools. This makes it a little difficult, I guess, because it's using a variety of athletes, we'll say, different types of sports to determine the effects of the cryotherapy. So I guess it's good because it's very inclusive, but it makes the research a little not as specific, I think, as it could be. I'll talk about that a little bit later. So what is whole body cryotherapy? Whole body cryotherapy is a special chamber. It's temperature and humidity controlled. It has to be very strict due to how the body responds to the cold. There's some guidelines and stuff. So the patient has to be minimally dressed, so like a bathing suit, something to kind of protect the skin a little bit, but otherwise you need to have skin exposure for maximum effectiveness. So there's the body has to be acclimated when you first step in the chamber. So you're going to start at negative 60 degrees for 30 seconds. This allows the body to adjust. And then from there, it's going to drop the temperature to 110 to minus 110 through minus 140 for a 3-minute duration. The temperature range is specific to whether it's electronically cooled or if it's nitrogen cooled. Or electronically cooled at 110, nitrogen cooled to negative 140. The other thing that's very important, and this prevents burning, is the patient can't be sweaty. They have to be dry, and they have to be minimally clothed. The idea is if there's a lot of moisture on the skin, then they can get burned and that can cause some injury. So some of the contraindications, and there are many, if someone has a cold intolerance, they have any type of respiratory, cardiovascular, blood flow disorders, previous hypothermia, and of course if they're claustrophobic, it is a tight chamber. Some of the other ones in the nitrogen-based chambers, the vapors that come up, the head's exposed, so a lot of the vapors come through the top. There's some untested medical or potential medical complications from the nitrogen exposure, but it should be it says it's at a low enough level that it shouldn't be unsafe, but it's just not something that's as tested. So the purpose of the whole body cryotherapy is for to elicit some physiological responses: anti-inflammatory, anti-analgesic, and antioxidant. It also has some therapeutic effects to reduce exercise-induced inflammation, reduce soreness. And then one of its other purposes that I don't agree with, because I think exercise is something that's irreplaceable for many other health reasons, but it can be used as a fat mass reducer due to its ability to mimic exercise based off the low temperature. All right, so the parameters, the duration is 3 minutes. 1 to 2 minute sessions provided minimal to no results. It's just not long enough to reap the benefits of the cold. But it can't be more than 3 minutes because the exposure to cold can lead to other issues. So for the session basis, a single session is usually proved to be ineffective. It might have some immediate acute results, but otherwise it doesn't have any long-term effectiveness. 20 should be the minimum to achieve those physiological results. 30 is optimum due to the complete hematological and immunological recovery. But it was noted that 6 sessions gave a subjective feeling from the patients of decreased soreness and their bodies feeling a lot more recovered. And I think for most athletes, this is probably the results that they're going for anyways, is they just want to feel recovered and ready for the next day. I don't think that they're necessarily looking for the physiological, nor do they care about the physiological results. But it's important to know that due to, with the increased amount of sessions, that there is some physiological changes that can happen, which can actually improve their overall longevity. So something to consider in the future for them, especially. For the clinical application, it's kind of difficult to maintain due to the frequency that it needs to be completed at to get the results. However, for those acute, immediate treatments, it may be a little more applicable to a clinical based. However, it's expensive. Treatment sessions can get costly, especially if you're talking about doing 6 or 20 or 30 sessions. And then accessibility, it takes up a lot of space to have a cryo chamber. There's nitrogen tank. There's a lot of PA and various other regulations that have to be followed to maintain one of these. So it'd be hard to maintain at an actual clinic. Maybe if there was a partnership between a sports team and a local-based cryotherapy business, then that might be a little more reasonable. For future studies, instead of having such a broad range, I would limit it to a specific sport. I'll use football as an example. It makes it a little more concise. And then compare the study, use the same athlete pool. I would say use starting athletes. They have a little more drive. They're starters. So they put a little bit more into practice. They've proven to the coaches that they've earned their spot as starters. So you would assume that they're given a lot more effort than your non-starters. So use your starting athletes. This also, in theory, would keep them a lot more fresh throughout the season. But then do the study, do the summer strength conditioning camp versus fall camp versus main season and potentially even postseason, just to kind of see the physiological responses and how the bodies overall respond to using whole body cryotherapy and the different aspects of a whole training year. Would be, I think, a very inclusive study and give us a real good insight as to how it affects we'll call elite athletes, and instead of just kind of bouncing around from various sports. Because in this study, the amount of sports that they used, rugby probably being the most intense, kayakers having the need for probably a longer lactate threshold based off of the repetitive motion of kayaking versus track athletes, which could range in all different time domains. And then the military is very, there's no specific, a military person does this is their sport or whatever. There's a lot of variety there. So I think if it was limited to a sport, a specific pool of athletes, and then kind of followed them throughout a year in the different phases of training, I think would give us a much better inclusive study on the effectiveness of whole body cryotherapy. And any questions, hit me up in class.